Hello, welcome to our weekly COVID-19 virtual town hall. My name is Eric Gleason. Today we are joined by Florence Bortle-Stevens, the Public Health Director, Kelly Dion, the Bay Area Hospital PIO, Steve Takis, the Battalion Chief at Coos Bay Fire, Brian Leon, our epidemiologist, and Barb Young, our American Sign Language translator. Trying something a little new this time using YouTube Live, but the rules are pretty much the same. You can ask questions via our COVID-19.questions email address listed at the bottom of the screen. And you can also ask questions in the live chat of the YouTube itself. We will be going through and answering questions for the next hour. So please keep the questions coming and keep them relevant. And I will turn it over to Florence to get everything started.
Thank you, Eric. Good evening, everyone. Thank you so much for being with us today again for our weekly meeting or town hall and conversation. We're looking forward to it. You may have a lot of questions since we were made aware of our first positive case of COVID-19, and so we're ready to answer you. Thank you very much for joining us. Thank you guys for being here.
Okay. We had some questions come in via our email over the last week. I think you guys may have looked at some of them. First question from Debbie, if it loads, says, I'm not clear about the one positive case in Coos County. Was that person transferred out of the county or still here?
Yeah, good question. So the individual was isolated pending result after they developed symptoms and were tested, and then they were, as part of a Oregon Department of Corrections plan, they were transferred once the positive test result came in to a facility that is specially set up for handling positive patients while they recover. That's a process known as cohorting, where we just make sure that we have individuals that are ill or not mixed with individuals that are well.
Brian, you're doing the lean. I got to try to get everybody to see your wonderful face.
Oh,
But then
I don't know
we're
if that's
not-
necessary.
Huh?
All right.
It'll catch up.
Oh, gotcha.
Yeah. It has about a 30-second delay, so you'll catch up.
Good.
It was a great answer.
Yeah. Anything I can do.
All right, let's see. Kathy had a question. It is fairly long. It says, hi, I do have a question. Our daughter lives in North Bend. She has her own apartment, and I was wondering, since she has her own apartment, she probably should not come to our house, should she? As far as we know, she doesn't have it, and neither do we. She drives to Eugene and stays at her boyfriend's house along with 2 roommates. They always stay home unless they go to the store. She comes back to her apartment in North Bend. He comes too. This has happened from day one, even before the coronavirus, but lately the sister gets together with them 3 times. His parents live in Oak Ridge. Basically, it sounds like they're making some trips back and forth to Eugene to do visits, and whether or not that is right or wrong.
Well, so we can discuss the executive order that is in place at this time in Oregon, and there are a few things we can talk about here. One is definitely in the order, it is recommended that any non-essential travel be paused at this time. I mean, the other thing that we could talk about is to the initial question about, hey, can she come and visit with us? I would say yes, as long as social distancing is maintained within during the visit. You know, I've heard of people like visiting from from the sidewalk, and people are on the porch or on the deck.
Yeah, I've seen that. I've seen pictures with friends of mine in San Jose for Easter. There's pictures of them standing outside of one of the in-laws' house, and they're doing their social distancing between the. So you're saying as long as they social distance, they should.
And as long as I would say the travel is deemed essential. What do you think? You want to add anything?
Yeah, it's kind of difficult thing to manage because you are dealing with a couple of different ideas in regards to order social distancing. If used, would certainly help matters. It's probably a little. It could be up for debate about whether or not such a visit would be deemed essential. As far as the purpose of the visit, it's tough to say. I think the biggest thing is the social distancing aspect of it.
And I think that's something I see a lot, monitoring the social media in the area and looking at some of the posts and questions that people have just between themselves, not necessarily at us, but the essential travel piece.
Mm-hmm.
Like, people seem to really struggle with, well, why can I go here but I can't go here?
Yeah, speaking from my part in this as far as epidemiology, we really prefer there to be nice, bright, distinct lines in definitions for things like this. Obviously, essential, some of the more obvious things that pop out are things like going to get food and going to work if your place of business is still operating under the current rules. Things that you need to do, but they're it's not just our physical sustenance that we have to worry about as far as essential. There you can be argued that for mental health, you don't want to miss seeing at least family, friends. It's really kind of a subjective thing the way it was put out there, and not extremely well defined. But it's also difficult to put in an executive order a massive laundry list of different activities that you can and can't do under such guidance. So it's kind of tough.
Susan has a question regarding the antibody testing. Is it available for COVID-19 in Coos County? And if so, where?
I'm not aware of any laboratories in the area that are using the antibody testing right now. And I'm not certain about when that would become available. And unfortunately, I'm sorry, still not certain about what exact application such a test would be used currently, as far as whether it would be diagnostic or fulfill some other role. You want to add anything to that?
I have nothing to add.
Okay, nothing to add.
I am
All right.
totally on board with that.
Okay.
All right.
They're saying they can't hear us. They're wondering if there is sound. Just got a text message.
I could hear fine. There was an echo there for a while, so
Okay.
but
Okay.
it's because we had two microphones going, but now it's cleared up.
Okay.
Lisa, on our chat up there, it says that it seems that better precautions could be taken at our live meetings, saying you're asking of others at least 6 foot distance. Why isn't it practiced at your meetings? Lisa, that is a good question that we're trying very hard to address, as well as still be able to address the community. They're all real close to 6 feet. When you're in the room, it just doesn't necessarily look that way because of the forced perspective of the camera. We are really trying to practice what we preach, though. So thank you for that question. We have some people saying that it does sound pretty good. Steve?
I would just say another point to that is I believe everybody at this table is doing self-evaluations daily to enter the building. We had to do temperature checks and some of those things as well. So we are trying to keep that 6 foot distance, but we're also taking other precautions on top of that just based on the work that we're doing.
Thank you, Steve. Jeff has a question. Wouldn't the antibody testing be necessary for both diagnostic and sampling before any reopening? California is doing both already.
So no, okay. So this is a pretty good question, and again, a lot of this generally is running into an issue where there's still little known about this virus. If we're talking about salmonella or some other infectious disease, we have known so much information about those illnesses for such a long time. We can essentially predict how long it's going to take for the body to create antibodies once an infection starts. We can predict within a pretty short window of how long symptoms are going to be and exactly what those symptoms are, and often severity. So an antibody test requires there to be extremely well-defined parameters of how long someone is going to take to be able to produce those antibodies if their immune system is functioning normally, basically all other things being equal. And so right now it's really just kind of an element of how certain are we that a negative result is going to be reliable, and in some cases, some of the ideas out there for using this test is essentially being able to say this person has already been infected and they can go back into the workforce potentially before other measures that we're taking more community-wide have come to an end. So I think everyone probably understands the basic idea that if we were to put somebody back into the workflow and back into the public and potentially expose other people, we would want to be really, really certain before we gave the go-ahead on that. Now, to be honest, I haven't seen some of the values and numbers, and as far as here in the state, we haven't received much guidance yet about how that test could be potentially used. I know some of the kits are being distributed to a couple of hospitals, and there are more on the way. But as far as from a public health surveillance standpoint, where we are looking for cases and we want to count and decide, within a reasonable amount of certainty, what the level of infection is in the community, that's just something that we're just simply not there yet. So I know it's a lot of hedging and a lot of ifs and all that kind of stuff. And again, doing what I do, I don't particularly like being in that position either. But that's essentially what we're dealing with right now.
Okay. The mayor of Bandon sent a question in and said that she thought she read an article or report on just how long the infected inmate had been at Shutters Creek. So people keep asking her, and she doesn't remember where she read it, but do we know when he was transferred in and
where and how long he'd been there before he tested positive?
So I think we honestly just need to forward that question to the Department of Corrections. That's not our information to give. As I understand it, he was at the facility for a little while before he was showed symptomatic. There is reason to believe that, based on what we know and what we're using as incubation period, that it's possible that he may have had symptoms before the reported symptom onset date. In addition to that, another thing that's making this a little bit more difficult is the fact that his symptoms were actually pretty mild, as far as we've been told. And so at that point, obviously, nailing down a symptom onset date could be difficult. But part of the investigation process is assuming a potential point of symptom onset that is actually before what was reported in terms of what the exposures may have been. So we're not taking it for granted that he could have been ill earlier. So that's basically part of that whole investigative process, and we're making sure that we're not really assuming anything.
Ray of Sunshine
Nice.
asks, are they using the new 5-minute tests at the hospital here? Is there a 5-minute test?
I believe the 5-minute test is antibodies, isn't it?
Is that what it is?
So we don't have the equipment at the hospital to result those tests or the sampling equipment to sample them. So we are still using the state lab to process our samples.
I didn't hear a question, but I bet it was great.
It was amazing.
I found that it's very difficult to try to listen to the conversation and actually hear you. I don't know that that's something that we can answer, Ryan.
So yeah, any answer would be speculation.
Right. Jeff, the question about the governor planning to let California go first, we don't really have any information to give an informed answer at all, I don't think, on that. Yeah, all right. We are out of questions.
Are we?
Yeah,
Oh, wow.
we're doing great. Okay, I'm going to go back and look at some of our older questions. I'd like to thank our IT department for helping get us up and running on this YouTube. Steve found this little thing that makes it look like that, so that's great. I really like how this has worked out. It's pretty cool.
What do you got, Steve?
Yeah.
There is another question, I think.
Oh, Jeff. What's the test unit they shipped to Curry County for?
If by county you mean the jurisdiction Curry County, I believe the test kit with a limited amount of tests was sent to Curry General Hospital, not Curry County. So again, as of now, that does not have a public health surveillance application at this point, if I understand correctly.
I believe that equipment tests for antibodies, not virus.
And there is a difference. And I think that might be worth a small explanation, because the antibodies piece is new right now, right? It's been the swabs for the longest time, and now this is the hot ticket in town, and maybe you can explain the difference.
Sure, we can expand on that. Especially, I think when we talked about it a couple of weeks ago, there was some audio issues, so that might have
a couple times.
Yeah. Sure. So this is really going to be basic. I apologize to any scientists out there that are going to freak out when I try to describe this as basically as I can here. But essentially, whenever there is a foreign body in our system, of course, there are white blood cells that are looking out for those things, and there is an attempt by the body to create molecules that will essentially try to recognize them on site and do something about them. So those antibodies they're also called immunoglobulin. And so there are several different kinds. The two kinds that are usually used for some tests are IgG and IgM. They show up at different times in the process of infection, and one of them essentially just shows up in the short term, and then another one will show up in the long term, and those are the ones that the body is basically using that we have long term immunity to, like some of our vaccine preventable diseases. So those, in this case, I believe it's the longer term ones that they're testing. Those can take a while, but they're also a lot more reliable, and that's the same situation for most illnesses that we use antibody testing for diagnostics. And so, again, it kind of gets back to that timeline problem where since we're not actually looking for the virus itself, we're looking for evidence that the virus was in our system. And because there's a lot of genetic variability between us, there could essentially be a range of time, whether it be 3 days after infection or 2 weeks after infection or whatever, where the body starts creating enough of those to where they're all through our system, and we can be able to detect them with a simple prick of the skin and a drop of blood. So that is a pretty difficult process when you don't 100% know what the timelines are and how reliable that information is. So that's why it's kind of a catch-22 a little bit. That's obviously a much simpler test. It's much faster. It's much less expensive. So those tests are, we would love to be able to have confidence and say, yep, you definitely had this illness, and now you're immune, and now you can go back to work. But again, we're just back to that whole. We're just simply not that confident at this point. There's just not enough data.
While you were giving an explanation, I had a question come in from a gentleman asking. He says he feels like the testing is first on the list for everybody. Like that's the hot topic for a lot of people is the testing and where we're at. And that's his question: is where do we stand on this? And like the current number of tests available to where they're being done. Like what does it look like? What does testing look like in our community? And I know that question comes up a lot.
Yeah. Currently, there are 3 categories of individuals who we are focused on for testing, and those are obviously people that become ill that are confirmed close contacts of a known case. They are individuals that are in a congregate setting where a lot of people are living together, and then of course, we're also looking at, on top of that, individuals that are high risk. We've said this before, 60 and over, immune system issues, underlying health conditions, that kind of thing. But beyond that, clinicians now have a little bit of leeway. We provide a little bit of guidance, and by we I mean Oregon State Public Health System. We provide a little bit of guidance in terms of, this is the testing criteria that we're currently using, but clinicians have the ability to order the test regardless of the circumstance, but they understand that with the limitations of tests that are available, and in addition to that, the likelihood that even if someone was infected, that they would test positive if they say didn't have strong symptoms or didn't have symptoms at all, is quite a bit lower than in someone that is having severe acute symptoms. And I left out the individuals that are hospitalized with lower respiratory symptoms. Those that's another category. So again, it's about capacity, and that means the number of sample kits. That means the laboratory capacity to run those tests once they're available. Yeah, it's just kind of a thing we've had to deal with from the beginning.
Right. We got a question on the feed from Edward James. Back to Shutter Creek, they did release an inmate who had completed his sentence at the facility without being tested. Shouldn't they have made sure he wasn't a carrier?
This kind of jumps on the last answer. Again, there are quite a lot of adults in custody at the facility. There are quite a lot of employees. We would essentially be talking about well over 300 tests. Also knowing that the likelihood of someone that say is asymptomatic as testing positive is actually pretty low. So then we would be essentially sending them out with the impression that they didn't have anything to worry about. Right. We are absolutely following up with that individual. We were given information. He does. The address we were given was outside of our county, and so multiple agencies are working together to make sure this individual has all the information they need, is monitoring their symptoms, and everything along those lines. So the short answer to your question is there's really not a way to ensure that anybody released is not a carrier. And of course, it's problematic to say if someone was scheduled to be released and they are showing no symptoms, that would be a problem as far as saying, nope, you can't go home or can't be released. So we're just doing everything we can to make sure that the exposures are limited. And it's really just another extension of contact tracing. We're making sure that any individual in the area that we're following up with, and there's less chance that they're going to be exposing others.
And I mean, your team has done a significant amount of contact tracing.
Yeah. There's essentially nearly 100 staff that were employed, and we have made contact with all but 6 of them and performed those interviews to judge risk. And we have also contacted other individuals that are secondary contacts of those first contacts. So we're doing as much as is possible, really, to make sure that we understand all of the potential exposures and are following those individuals as closely as possible.
Thank you. John has a question. Are piercing shops open and able to do piercings during the closure? I'm curious if new piercings are okay or considered elective. I really want to get something done, but want to make sure.
Well,
I mean, they feel pretty elective. I mean, to me.
yeah, well, they're namely discussed within one of the executive orders from Governor Brown.
Okay.
So
John, if you want to send an email to that email address at the bottom, I can get you the information going. Okay, we're looking for more questions if you guys have any. I know that moving over from Facebook to YouTube, I'm not sure if we caught everybody, but hopefully we can drag everybody along over the next few weeks. Steve, what are you guys seeing from the first responder standpoint? Not a lot of people ask a lot of first responder questions, but usually to get someone from wherever they're at to wherever they need to go, especially those that are more critical, that need to be hospitalized, they have a significant amount of contact with them from first responder standpoint.
Yeah, so I think one of the biggest things that we've seen from this is actually a small downtick in our call volume. So Last time I checked the call volume for our agency, we were down about 25%. And in talking to friends throughout the state and first response, I think everybody's kind of at that point. And what we're seeing is more people more appropriately using 911. So they are the ones that are truly sick, are needing some sort of help, needing some sort of intervention. And that's probably the biggest thing that we're seeing right now. I think the public has done a great job helping us keep our responders safe by answering all the extra questions that our dispatchers are asking that is coming from some different state guidance, just helping us make proper determinations on what PPE to use, what personal protective equipment to use, to make sure that we're not using it unneedingly. But yeah, I think that first responders, I think the one message that I could send out from my agency and what I believe all first response agencies in the county is we're still here to serve. We're still here responding. Our response may look a little bit different, but we're still here, and we encourage people when they need 911 to call 911, and we will respond appropriately.
What about you guys, Kelly, from like a hospital standpoint?
For the past 3 or 4 weeks, our ED volumes have been down by at least half. Inpatient volumes are down because there's no elective surgery, but kind of the same message that we stand ready, and if you're sick, we'll still see you in the ED, and if you need urgent or emergency surgery, we're staffed and ready to go.
Awesome. Mike has a couple questions regarding PPE. The first one is, do you know if we were on the shipment for PPE from the state?
Yes, we actually were. We got a delivery from, I believe, the National Guard yesterday, towards the end of the day. So,
Okay.
yay!
Awesome.
On that point, I would just like to thank Coos Health and Wellness for the coordination they've done with the state to help, I think, all of the first response agencies in the county and the people that have been deemed necessary to receive some of the PPE. So I know my agency, we had a little bit, but we definitely were not prepared for this without the help of Coos Health and Wellness and what the team here has done to make sure we are ready if we have that surge or when that surge comes.
Mike also said, can you point people to the direction of proper face mask use?
Do you want to take this one?
You know what? I think the best thing to keep in mind when you have a face mask on is it does not protect you as much as it protects the public from you. So when we ask you to wear a face mask, it's with the idea that we're trying to prevent you from spreading the virus if you should have it and be asymptomatic. The other thing about face masks is people are not used to using them, so they have a tendency to touch and adjust constantly. And I'm probably the worst person on the planet about touching my face, but put me in a face mask and I'm even worse. So when you put your face mask on, you have to maintain that consciousness to not constantly touch and adjust your face mask. If it becomes wet, if it gets humid to the point that it feels wet on your face, it's no longer helping anybody do anything. You need to change it. It should fit rather snugly. You shouldn't have a whole lot of gap space there. And if you are wearing N95s, if you got a hold of N95s through a hardware store or online, people with health conditions really need to be careful about wearing an N95 because that's a lot of pressure gradient to be in for a prolonged period of time. And when we do it in healthcare and in other industries, OSHA has a standard that we test people and make sure they're prepared for that. And so they're not really all that advisable for the general public for long-term use.
Something to add to that is the mask should be on or off. So I see a lot of people trying to do the right thing by having a mask and wearing a mask when they're out in public. But then we see them driving in their car and they've got it kind of down around their chin and things like that. So anything that's on that mask, they're now inhaling. So have it on to protect others, and it does offer a little bit of protection to you. But once you're back in your car, once you're back at home, or once you're done using that mask, take it off fully and set it aside until you're ready for it again.
Well, and we've posted some stuff on our Cruise Health and Wellness Facebook page regarding the proper way to use the mask, and we will share that again tomorrow mornings just so that people can get refreshed on that. And if it's something that people really want to find, we will refresh that post. We have a question. Why are the marijuana shops allowed to remain open?
Because people are quarantined with their families.
They need
That'll
some
take away
relief.
stuff, folks. That is an interesting question.
I think the governor deemed them essential, didn't she?
Is it from a medical marijuana standpoint?
I think it's simply an issue of it's not on the list of businesses that we're supposed to close. It's the simplest answer.
All right. Mike is always so complimentary of us. I like when Mike listens and makes us feel
I
good about
know.
ourselves.
It's always a
Yes.
little boost.
Pretty amazing.
Um,
Thank
we
you,
have-
Mike.
We have another question from Papa regarding tests. Do you know how many test kits are currently available in the county?
We have a rough idea. Probably less than, I would say between 1,500 and 2,000 at this time. Because this is due to the creativeness of the lab staff at the hospitals. They were able to duplicate the media from what they originally had. And so now that we have some tests, we have been initiating some very initial discussions about the possibility of conducting some very targeted testing in the community. The details, the testing criteria, the symptom profile, and the logistics still have to be developed and agreed upon with our partners. We will make sure if we decide to go ahead with such a testing event that we provide the information to the community.
All right. For those of you that have been able to watch both of our Facebook Live streams and this one, if just for my own personal need to figure out what works best, if you could give us feedback, not necessarily on here right now, but if you could go to our Facebook page, send a message through us through Cruise Health and Wellness, just kind of give us some feedback about what worked good on this one versus the other one, or what you liked about the other one that maybe you didn't like about this one, just so that we can continuously try to improve how we do these things, because I don't see them going away anytime soon. And it would be nice to have something that's user-friendly for everybody. I know that we did get a message from someone missing us on Facebook Live. But we did have a significant amount of technical difficulties with our sound through Facebook, and had heard that we weren't the only group that was having this problem. So we do really value your feedback as the community, because it helps us get better at our jobs. And that's what we should be striving to do always, is to serve you better, and hopefully this is a way to do that. If you have any more questions, we still have about 20 more minutes. I can only talk for so long without running out of things to
That's really surprising.
Well, it is, no, and I think there's a lot of people out there that would disagree with my testing. Yeah. Just trying to think about all the things that have been happening throughout the week. And I think the biggest one was
I kind of expected a deluge of Shutter Creek questions.
I really did
Yeah.
too.
Yeah.
I did too. I thought there would be more Shutter Creek questions. However, the Shutter Creek answers don't really change that much. So
That's true.
I guess as many Shutter Creek questions as you have, there's really only so many answers you can give. So you've probably hit most of them. And a lot of the questions, I know that this new testing thing, I've seen celebrities in California, right, that are posting. There's some comedians that have posted that they took it. There was one, like, actually, as the thing was changing, to say they didn't have any antibodies and they're negative and things like that. I know as more of those things come out, more of those stories hit social media where a lot of people get their information initially, that these questions will come up. And I think you've done a pretty good job of trying to answer them.
Might be a few microbiologists that disagree with you there, but I
Well,
I
you know,
did what
they're
I can.
welcome to. Well, this whole thing has just been a constantly evolving scenario.
Right.
And if there's one thing that I know, at least from my perspective on the whole situation, watching you two like ducks, you look like you're pretty calm,
Yeah.
but you're just paddling away, trying to stay with, keep the current from driving you away. This has been a really interesting thing, and I think not just for you guys, but for the community as a whole. Like, to see deer were walking down the street this afternoon.
So, just to maybe follow up on what you were talking about and the fluidity of the situation, I believe we had a question on the email yesterday about the updates that we're providing daily, and why pretty much is it called an update if it is a day late. And so I thought that was a great question. So I wasn't sure about the lateness that was referenced, right? But it takes some time for a test to be performed, so the sample to be collected, and then that sample to be sent out to the lab, either at the public health lab or at another of those private labs. And then the results, so the tests are processed in batches, and then the results are coming in batches too. In the particular situation of that we experienced last week, so it looks like the test result was known at the state lab on Thursday afternoon, was communicated to the ordering provider, which was the Department of Correction at the time. And so they did what they did with it, which was posted it on the website. And so the process at the state level is that the lab results do not come to the public health they come to the public health divisions, but they're not being processed until the next morning, which is one of the reasons why it took that long to we had the confirmation that evening because Brian called the state lab and made sure, and called the prison and all that to make sure that this was a confirmed case. But the reporting of the cases that are resulted on Thursday are reported the next day. So it's still an update. It's not a just in time update, I guess. And it's actually really good turnaround time for public health data. It's almost like on the
real time,
almost real time data, which is not always the case. So I just wanted to address this because I really thought the question was good, and we had you can imagine the same questions ourselves.
Yeah.
I mean, just like most things, I know, we got this a lot in the military, so you can only work on the newest information you have, however that is. We're
Right.
a new
Right.
means to that
Right.
situation. And I think that getting the information you've been able to get out in the manner in which you've been able to get it out has always been the most up-to-date information. And yeah, I think it's good to understand why, we're always a few days. So, but it has been nice. I know a lot of people that really appreciate getting that. It gets shared in a lot of places.
I would say that reporting is really just one small portion of what's being done
Yeah.
by the team here at Coos Health and Wellness and all the community partners and everything too. It's an important piece, but what comes out in the reporting and the numbers is already done. So there's nothing we can change about those numbers that are coming through. But the positive impacts that are happening every day by the partnerships that have been grown throughout this and supported, especially by Coos Health and Wellness, and all the different facets of planning for this, from first response to hospitals to different at-risk groups in the community. There's just so much going on that it's almost behind the scenes. I think that there is some stuff going out through PSAs and through different things that talk a little bit about it. But this whole process, the whole responding to this pandemic is huge. And the numbers are just one small portion of that.
Oh, and you're absolutely right. I grew up here. Except for the time that I was in the Navy, I'd been here, and I think that the ability for the community partners to come together, to try to work together, to move the community as a whole forward in a meaningful manner to keep everybody safe and healthy is something that I have never seen from inside this community as far as a response like this. And you're right, it is, every little piece is its small behind the scenes thing, but we're all, I think this is a pretty good representation. You're part of Coos Bay Fire, Kelly's part of Bay Area Hospital, we have the public health team. Everybody has the same goal, and we get to put all of those resources together finally and say, we're gonna do this as a team. And that's been motivational, I would say.
That's great, Eric.
Thank you. I mean it.
Do we have
Good
any
emotion.
questions through Facebook at all?
We've had some comments through Facebook, but just about not being on Facebook. And then someone actually said that they think the audio is much better this week.
Nice.
Good. That's
So
great.
that is good. I'm happy to see that
Yay, you guys.
we found, we're still gonna, like I said, we're gonna continue to tweak this. Maybe we can try to find a way to do it multicasting on both platforms so that the people that really like Facebook can be on Facebook. The individuals that maybe like YouTube can make everybody happy.
That's really important.
Or less angry.
Yeah.
But, email. I like this question, actually.
Oh.
Pop has another question. Are you satisfied with the guidance and specific information from the State Health Authority? Call this shot, dude.
You want to do this one?
Do you want to do it? I can take it. Yes.
Go for it.
So, I think, like you discussed earlier, the situation around COVID-19 has been very fluid. This is a novel virus, so there is a lot of information that we're discovering as we go, almost. And the guidance from the WHO, the World Health Organization, from the CDC, and from OHA have been evolving based on the data and scientific research that has been done around this disease. So, I think the Oregon Health Authority Public Health Division is doing a really good job at keeping up to date with the latest guidance. has been doing a really good job at, and this is an assumption on my end, but guiding the recommendations for the mitigation measures that the governor has taken. Those, when you look at the projections that have been done and the modeling, those projections are looking good. Which some experts say that means that the hard work that everybody is putting on and by staying at home and is working, is paying out. So I think they have been, at least in our experience, extremely responsive to our questions and to our needs and sometimes to our concerns. So I would say, overall, we're in this together. This is the public health system from the state of Oregon, and so I think to the question, are we satisfied? Yeah, we are.
I would just add that there are 36 counties in the state, and I think it would be safe to say that our public health resources have been maybe a little strained compared to what they were, say, 20 years ago. I believe there's been some recent articles talking about how there were a lot of jobs lost in every sector in the financial crisis that we had a little over 10 years ago, and that none of those, at least for public health, none of those jobs really kind of made it back. And so the state, certainly we can all say and point to potential areas of improvement, but I am actually, I can say anytime I've reached out to the state, they've always been really responsive. All of us have worked well over 40 hours a week for months. They've been doing the same thing. And I know that sometimes some folks will feel that as a small county far away from Portland, that we don't, there isn't necessarily the same level of interest in us. But I would say, keeping in mind that there are areas of the state that have had, hundreds of cases and all of the work that goes into that. I mean, we've described one case, and granted it was in a congregate setting, but I mean, it required just a tremendous amount of person hours in order to just handle those interviews and get our heads wrapped around the entire situation. And there are absolutely, my team has just worked their tails off, and that's one case. So, yeah, I mean, we just kind of have to look at the situation for the state overall. I'm really proud of what we've done here. Steve's mentioned, the community partnerships that we've had, and a lot of phone calls and emails going back and forth to make sure that we're staying in the loop. And ultimately, sometimes you just got to make sure that you're doing the best with what you have. And I know that all of even the state staff, they're very, very dedicated to making sure that they're protecting our community. So yeah, we haven't always been pleased with every single result, but I'm proud of them for sure.
Well, this is somewhat unprecedented. I mean, it's been a lot of adapt and overcome and improvise kind of behavior for all levels, from OHA to all the way down here to us. It's everybody has to adjust to a very new and very dynamic landscape when it comes to all of these things. Even just what we were looking at from the beginning to now has changed so much, just in some profiles that we had when we started versus what we have now. And it's a big deal to be able to still communicate, try to do all that stuff and adjust accordingly. Kathy says that we have excellent formats today. Thank you, Kathy. She also asks, might there be a time when we can be tested for pre-existing immunity.
I'm not 100% sure what she means by pre-existing immunity, unless you're talking about someone that may be just genetically predisposed to not having an issue with the virus.
Well, I wonder if it's like, oh, hold on. She sent an email. I didn't clarify it. This is a whole different question. I wonder if it's like if there's a second wave, can you figure out? But that would be that antibody testing,
Potentially,
right?
it could be, yeah.
Yeah.
That again, that's one of the roles that antibody testing could play is feeling somewhat confident that someone could return into public without being concerned for social distancing and things like that. Yeah.
Sure. Yeah, I could see that for like another ramp up if
Right.
you could be tested at that point.
Mhm.
She did have another question regarding washing groceries when they come into the house. She's asking about a specific solution. Lugol's iodine solution work against COVID-19, or do you have any suggestions as to what you might want to do when you bring your groceries home?
I mean, if they're in a container that would be safe enough to disinfect the outside, and you're not concerned about whether or not some of those chemicals could get into your food, that probably wouldn't be a bad idea. Your hard, non-porous surfaces, foods, that are more fresh, like produce or something like that. I mean, I think we would always recommend rinsing most of the produce and other items, but I say this hedging a little bit, but again, I have yet to hear of a foodborne transmission of COVID-19 that's been identified. So I would be more thinking about the outer surface of containers rather than the food itself. Hopefully that makes sense.
Yeah, no, I think it does.
Okay.
I think it does. I'm going to ask just a question based on an infographic I saw on another site.
Okay.
And it had to do with, it was basically geared towards first responders, healthcare workers. When you come home and you say, I guess maybe anybody that works in a setting in which they can, maybe you work at Walmart.
Right.
You come home, would it make sense to just change, get in the shower, get everything that you have already, that you had on the day, that you have the day on you at that point?
Mm-hmm.
Does it make sense to take that off, shower, get into something different so that you're not dragging it around your house? I mean, I've seen more than one of these infographics and people talking about that. So I don't know that it's anything we've ever really truly discussed.
Did you let the healthcare workers?
Yeah, Kelly, why don't you get in on this?
I know that a lot of our healthcare providers that work in the hospital kind of make a practice of that anyway. We're not always dealing with COVID-19, but a lot of times we're dealing with things we don't want to bring home. And so I guess that's just part of the healthcare culture, is to go home, change your clothes before you start hugging on your kids. And I think that maybe with this COVID-19, people are a little bit more nervous about it and are a little more diligent about washing up when they get home.
Yeah, and I think from our standpoint, I think the COVID-19 has probably reinforced some lax practices that we had in the past. For our agency, and I think most first response agencies, we try and leave uniforms and all that stuff at work, and we wear just normal clothes back and forth, so we don't have that cross contamination. But I think that was maybe a little laxed, and this has reinforced the importance of us doing that. So
That's a great point. I think you think about all of the things. I mean, first responders, healthcare workers, all of the things you're exposed to on a day-to-day basis. I mean, now we're lucky to have you guys. I'm glad you're here. I think it's awesome, and I'm glad it's 6:30.
That one fast.
It did. It went fairly quick. I will, again, if you're listening and you have input that you want to send us, go to our Facebook page or send us feedback on the COVID-19.questions email based on what you liked, what you didn't like about our stream tonight. Also, as always, all the way up until next Tuesday night, we'll be accepting questions through that very same email. I want to thank Florence and Kelly and Brian and Steve and Barb for being here and joining us this week. I haven't been able to help it. The name of my next band is Dion Leon Take Us and Yell. Just feels fitting.
But Barb is the true MVP.
Barb is the true MVP. Yeah. Runs a mile with her hand. She's going 100 miles an hour. They're trying to keep up with us. So I hope everybody has a great night, have a great week, and as always, stay well. We'll talk to you next Tuesday.